Dr. Len Abbeduto.
We do know that some of the increase is due to greater awareness and better diagnostic practices, but I think that
recognizing that we can have what we call comorbid conditions, and so selective mutism occurs with Fragile X syndrome.
We recognize more acutely than ever before our need for social connection and for the support and security that come from being part of a community. That's what people with autism and their families want and are due as well. At the same time, however, the pandemic has increased the social isolation that many people with autism experience, deprive them of the support they need to learn and work. And for some
Today is the relationship between autism spectrum disorders, or ASD, and intellectual.
So welcome back to my channel. I'm really excited because we have a very special guest, Dr. Leonard Abbeduto. Dr. Abbeduto is the director of the UC Davis Mind Institute. And if you're not familiar with the Mind Institute, the acronym stands for Medical Investigation of Neurodevelopment Disorders. And he earned his PhD in psychology from the University of Illinois at Chicago. And he is really a nationally recognized expert in behavioral health with individuals with intellectual disabilities. So he has a plethora of knowledge, and I'm so excited for him to share his knowledge and his experience here on this channel, because I know that a lot of you are very much interested in behavioral health sciences and learning more about psychology and mental health professions. So Dr. Abbeduto has published more than 130 articles, books, chapters, reviews on Fragile X and autism and Down syndrome, among other disabilities. And I'm not going to talk too much more. I just wanted to give an introduction, but he's also received numerous awards, including a Emil H. Stager Award for Distinguished Teaching from the University of Wisconsin-Madison. And he has published several books, and most recently, the APA Handbook of Intellectual Developmental Disabilities, just December 2020. So this is really exciting, and I'm glad to have you here, Dr. Abbeduto. So thank you for joining us.
It's my pleasure. Thank you for inviting me.
Yeah, so I know that you currently in your position, you're the director, so there's a lot of different things that you oversee in your position there. Can you tell us a little bit about your day-to-day roles?
Sure. Well, so the Mind Institute, we're a part of the School of Medicine and the Health System at the University of California, Davis. We're located in Sacramento, on the campus in Sacramento. And we have about 60 faculty that participate in our mission, and probably all together with staff and students that are affiliated with these different programs and labs, probably about 300 people or so work at the Mind Institute. And we have, first and foremost, we're kind of a research institute, so we have a number of research programs. We also have an outpatient clinical program that sees children, pretty much infants all the way to young adults, and even on occasion people that are kind of aging. And then we also have a variety of training programs. And so pretty much every day my role is to help direct those activities in all the areas of research, clinical activity, and training, as well as do my own research. We have a pretty active lab, as you mentioned, on a variety of disabilities. So day to day, I'm meeting with staff. I meet with families a lot, or talk to families either through Zoom or on the phone that want to participate in research or have questions about clinical access or clinical programs that we have and how they can participate and be involved. And then I also spend a fair amount of my time with potential donors, because we raise money to help kind of accelerate some of our innovative programs.
Oh, thank you for that. Yeah, you know, in hearing you talk about your day-to-day responsibilities and duties, it's interesting to hear that you as a director still do a lot of clinical work or work one-on-one with families. Because usually when we're talking to directors or managers of these programs or policy development, usually it's more leaning towards just the macro side. So it's really interesting to hear the diversity in your position and that you're still able to work from this position where you're very much involved in overseeing the program and the policy of the program, but also, as you mentioned, you're working with the families. So do you spend a lot of your time working? Is it 50% with the families? How would you say that you break that up?
Yeah, I'd say that it's probably a relatively small proportion that I really interact directly with families. And it's just because of all of the other kind of pressures and other responsibilities. I would wish I spent more time. We certainly, when families come to participate in our particular research program, I do my best to meet with them at the end of the day to talk about the research with them. Sometimes that's not possible. And certainly I talk to families who want to learn more about how they can participate in research. If families are having trouble, either insurance issues or other sorts of things so that they can't figure out how to get our services, they'll talk to me directly and I'll do my best to help them. So, I mean, it's a relatively small proportion. I would say that's the one thing I miss. Before I was director, I think I spent a lot more time working directly with families and I really enjoyed that. But I try and do as much as I can now.
Mm-hmm. Considering, all the work that you do now, and it's kind of split between obviously being the director of the program and overseeing day-to-day affairs with that and talking to the families, I'm curious to know what led you to your position now. What made you want to get into this field?
Well, so in terms of kind of way at the beginning, in terms of getting into the field of developmental disabilities, I was a graduate student in psychology, and I was studying child development and was very interested in issues around language and communication and how children learn to learn language. And I had an opportunity to have a research assistant position on this really large project that was directed by a former mentor of mine, and it really focused on adults with intellectual disabilities, and in particular, the nature of their friendships and how they formed friendships and what were the barriers to them forming friendships and how did those friendships kind of enrich their social lives and their well-being. And he said, well, we have some money and I know you're interested in language, and so I'd like you to do a study of some of the language and communication challenges among these adults that have intellectual and developmental disabilities. But I really don't want you to do that until you spend some time really understanding who they are and what their lives are like. And so at the time I thought, well, this just seems, I know how I could do my study. This just seems like, not a good use of my time. But I spent about 2 or 3 months visiting different group homes, and at that time, very institutional-like settings for people with intellectual disabilities in the Chicago area. And the things that I learned really, kind of changed my interest. I knew nothing about disabilities. I really learned a lot about kind of the variety of challenges and the variety of abilities that people with disabilities had. And I also learned a lot unfortunately, about the really not ideal circumstances in which many of them had to live. Some of the homes were not particularly pleasant places to be physically. There weren't really great activities to keep people engaged, to keep them employed. And it just really seemed to me that there was a lot to be done in terms of understanding how we can make life better for people with intellectual disabilities. And so it was just kind of happenstance that I kind of stumbled into that. And my former mentor was very wise to make me not just jump in and do my study, but to really understand the people and what their lives were like. And that really changed the direction of my career. And then, so I did research and was a faculty member for a very long time, and just kind of gradually took on more administrative responsibilities and found that I enjoyed that. I was pretty good at it for the most part. And I also recognized that I could have an impact on people with disabilities and their families, not just through my research or not just kind of directly working with them, but also by developing programs, making sure these programs were efficient, getting other people to, to support their work. And so that kind of led me increasingly to do administrative things in addition to research, and kind of led me to my current position, which I've been in for almost 10 years now.
Oh, well, yeah, certainly working with families and having that direct patient care is much different than just looking at things from policy level. And I think that certainly opens up a lot of doors for people in behavioral and mental health, especially with research. I think that a lot of the time we go in hoping to just learn more through literature and what is the information that's out there already. But when we have the ability to work with families and work with people, it becomes that much more meaningful and passionate. And so that's what it sounds like with you, and kind of how it created this journey for you to where you're at now. And working with this specific population with developmental disorders, I know that, a large part involves working with Down syndrome, autism, and Fragile X. And I know that Fragile X is kind of like a newer term that has been thrown out there. I think as a society, we're more familiar with the terms autism and Down syndrome. So I'm curious to hear more about Fragile X. Can you speak more on Fragile X?
Sure. So it's an X-linked disorder. So it's really something that's caused by a change or a mutation, an alteration in a single gene on the X chromosome. And it really has an impact on kind of how neurons are born and develop and how they function. And so it really has kind of these really pretty dramatic impacts on brain development, as well as kind of, physical aspects of health. It's the leading inherited cause of intellectual disabilities, and so it's passed on. The genetic mutation is passed on from parent to child, and it's the leading single gene cause of autism, in the sense that if you look at people who have Fragile X syndrome, probably around 50 to 60% will also meet diagnostic criteria for having autism, which is autism is totally a behavioral diagnosis. It doesn't really have anything to say about the cause. And so again, 50 to 60% of people with Fragile X will meet these criteria for autism. And if you flip that around and you say, well, how many people with autism have Fragile X syndrome? It's probably around 5% of people that have autism will also have Fragile X syndrome. And, we've known about Fragile X syndrome actually for quite a long time, but it's been, because it's a relatively rare condition, probably about 1 in 4,000 to 6,000 males and maybe 1 in 8,000 females. A lot of physicians still don't know about it. And one of the things that happens is that oftentimes physicians or pediatricians won't always recommend testing for the genetic testing to identify Fragile X syndrome if they see a child with developmental disabilities, which means, again, because it's inherited, other children in the family can also have Fragile X syndrome as well. And so I think that there needs to be increased knowledge about it, at least if for no other reason, is to make sure that people understand their kind of, family planning options and things like that. But certainly there's a wide variety of challenges associated with Fragile X syndrome, but there's a lot of variability. So just as one example, probably 90% of males that have Fragile X syndrome, so they have this mutation in the gene, they will meet criteria for having an intellectual disability. For females, it's probably only about a third will have an intellectual disability, and they may have learning disabilities, or they may have kind of comorbid mental health things, but have kind of average range cognitive abilities. And so there's a lot of variability, and it has to do with kind of the genetics of being a male or a female, and having 2 X chromosomes in the case of females, but only 1 in the case of males. So there's a lot of variability, which means that the more we know about it, the better we can understand the variability and be better to kind of provide support that's tailored to what the individual needs.
Mm-hmm. Why do you think that there's such a lack of knowledge within this community and this diagnosis, in particular with primary care physicians and physicians in general?
Well, yeah, and I think it's also probably for a lot of, I think it's changing. I think, as time goes by, I think more and more people know about it, partly because there's a lot more research. I think increasingly people are more aware of genetic advances, but I think that there's still a lot of lack of knowledge. And you hear this a lot. So if you talk to families that are affected by Fragile X syndrome, oftentimes what families will say, and this is true, is that they educated their pediatrician. They gave the pediatrician things to read about Fragile X syndrome because maybe the pediatrician knew about it, but not that much. They certainly give information to teachers, special education teachers and other teachers and other people that provide care for their sons and daughters that are affected, because there really is just still this kind of lack of knowledge. And so, I think it may be, again, because it's a relatively rare condition. I think that that's meant that not everyone kind of learns about it in their course of study as they're becoming a physician or a nurse or an educator. But certainly, I think we, those who work in the field, really need to do a better job of making sure that people know about it and are trained about it. And there are some really good national organizations that are kind of patient advocacy organizations that are doing a really good job of trying to get the word out so people know more about it, know how to test for it, know the challenges that families face, and also the wonderful value that people with disabilities, whether it's Fragile X or any other condition, kind of bring to families and to society. And also just kind of how to help support families. And so I think, again, it's changing because of these patient advocacy groups, but certainly not quickly enough.
Do you think that the lack of knowledge is also attributed to the stigma with mental health disorders and behavioral and developmental disorders?
Yeah, maybe to some extent, because I think that there's generally, people, perhaps because of the stigma, people just aren't interested in learning about it, right? And I think that they have kind of if you say, say something about an intellectual disability, probably what most people would think of is somebody that has Down syndrome, because they've had more experience, likely, with people with Down syndrome, either in their own lives or, in media and things like that, but they're really unlikely to have knowingly encountered someone with Fragile X syndrome because it's more rare. And certainly, it's not in the media, right? And so they would have had less exposure. So it's partly stigma, and I think just kind of a lack of, media attention and other sorts of ways of getting that information out there, which is, again, I think it's unfortunate because I think there's so much benefit to all of us for understanding and being familiar with and appreciating, variability among people, right? That we all have, strengths and weaknesses. And I think it would be great if people were just more open to learning about people that have challenges and how they can be supported, and the value that they have and the respect that they're due. And I think that would just be, I think it would be enriching for everyone if people were more open to that.
Right. Yeah, it's definitely an area where just like you mentioned, our culture could benefit from being more open-minded about, so that we just have more information and education at our fingertips. So thank you so much for talking about that. Something else that I wanted to talk about is, so pre-pandemic, it was kind of towards the tail end of 2019, you gave a talk and spoke about traditional approaches to providing clinical care and services to individuals and families affected by developmental disabilities, and how they're failing because of limited resources and barriers to access. And during that talk, Dr. Abbeduto, you suggested that technology-delivered care may offer a solution. And you also provided the example about presenting data on the efficacy of telehealth, your telehealth delivered parent implemented language interventions for Fragile X syndrome. You spoke more on that and the telehealth delivered in that capacity. And when I read about that, I thought that was very interesting, because that was before COVID and before there was this pandemic that really started to, we started to see this outbreak here in the United States, and we started doing telehealth services more post that. And so to see that this was something that you spoke about pre-pandemic, I thought that was very interesting. Can you talk a little bit about that and how that has changed since we started transitioning more into telehealth services? Has that gotten better and more accepted within the community?
Yeah, I think that's a really good point. Yeah, so the reason that we became interested in terms of my research in telehealth had to do with, as we mentioned, if you look at Fragile X syndrome, for example, it's relatively rare. So if you take that from the perspective of a family, and you take, as you pointed out, the lack of knowledge that's generally out there, for many families, they're nowhere near an expert who knows about Fragile X syndrome, who can provide up-to-date care, who knows how to help support the child and the family. And so for them, the options are, maybe sometimes like getting on a plane and going to an expert. And for some families, they can't afford that. Or if the child has really challenging behavior, travel is difficult, if not impossible. And so, by necessity, we started to think about, well, how can we provide therapies and support for families if we're always making them come to us? It's just not going to work. And so and this is kind of a more general thing that we've been thinking about at the Mind Institute for a long time, and we've come up with this concept of clinics without walls, and the idea being that at some point we're going to be of limited use to families if they always have to come to a physical building to see us. And so we wanted to explore how we can use technology to kind of basically go and bring clinical care to families. And so the other thing about what we do in terms of language interventions is that there are, many of these kids with Fragile X syndrome get very little speech and language services, even though they really need a lot of help there. There's just not enough resources to do that. And so what we decided to try and do was to help parents learn how to provide, kind of interact with their kids in ways that would support their language development, really act like kind of paraprofessionals in a way, but to do it in a naturalistic way so that it wasn't work, it wasn't, kind of drill and practice, but it was just kind of interacting with their kids in kind of optimal ways. And so we decided to combine that notion of a parent implemented language intervention to essentially turn them into the therapists, if you will, but to do it in their homes. And so what we did was we would provide PowerPoint presentations to families, and we would use Skype or Zoom or something else. And we would show them examples of what we wanted them to do, kind of give them the background. And then we would coach them in real time as they sat in their living rooms or in their kitchen with their sons and daughters, using kind of a Bluetooth bug in the ear. We would coach them so they could have practice in these strategies. And what we found was that in general, the parents learned the strategies that we taught them. Some parents had a more difficult time learning than others, but pretty much everyone we've worked with has made progress. And their children improved in terms of language. And importantly, when we kind of finished the studies, and we've done a couple of studies with families that have children with Fragile X syndrome of different ages, we were worried about how the families would feel. Would they feel that this is too much pressure on them? It's hard enough being a mom or a dad under the best of circumstances, and now they're kind of delivering therapy for their kids as well. And so, pretty much when we kind of did exit interviews with families, they all said things like, this changed our lives. We feel that we're closer to him than we ever were before. We really saw progress. We really feel like we can help our kids, and it just doesn't have to be professionals. And then importantly, they also said, we also know how now we can talk to the speech language therapist. So we can ask questions because we understand what they're doing more. And so, it really was relatively easy to do, relatively cost effective. And even in our very first study, I think we studied like 12 families that had, toddlers and preschoolers with Fragile X syndrome. And those 12 families came from like 8 or 9 different states in the United States. And we had one family from Canada. And we would never be able to do that if we required them to come in and see us. And And so we at the Mind Institute, we're doing we have a lot of research that's happening as a way of kind of testing and developing these procedures, because we want to make sure that we just don't say, well, let's do everything with telehealth. We want to do those things that work. We want to know how to make them as effective as possible. But we're doing a lot of, during the pandemic, a lot of things that we thought clinically we couldn't do. When you're forced to do them, you figure out that actually you can do a lot with telehealth. And I think that's increasingly easy because so many families, particularly young families, they've kind of grown up using technology. And so for them, much unlike me, who's older, it was, I think they kind of understood it better. But we can do things like we can do clinical visits on iPhones and other smartphones. We're also doing things like, can we use virtual reality as a way of training attention in kids that have ADHD? I think that there are just so many opportunities for us to use technology, not necessarily to replace, one-on-one therapy, because I think sometimes you have to see a person, you have to be in the room. But we also know that any field we talk about in behavioral health, whether it's in social work or psychology, whether it's having to do with depression in adults and anxiety, we don't have enough resources to help everyone. And so if we can use technology to kind of extend our reach and to extend our resources that we have available, I think it makes really good sense, because I think we can support a lot more families. And I think the access is really the only thing we have to worry about, is that what we don't do is kind of create other options for families who already can get services. We want to make sure that families who are in rural areas or maybe in lower resource communities can also access these services through telehealth or other technologies. And so I think we just have to be careful that we don't reinforce the disparities in access that exist.
Right. Yeah, I mean, that's very groundbreaking. And again, I bring up the point of you having this talk and talking about the telehealth services right before the pandemic started. So what a coincidence, and at the same time, such a blessing to be able to have that foundation, and then going into the pandemic, still being able to provide those services and even expand those services. But you also mentioned some of the time too, you really have to be in person, and it's not about completely changing everything to telehealth or to technology, but really being able to just expand the services to those that need them and still be able to have a person when necessary. The other thing as well is that in talking about these services and being able to provide psychoeducation to caregivers and families that are in different countries, I imagine too that the patient or the child that is diagnosed, being in the comforts of their own home and having somebody that they trust provide these services to them, I would think that that would certainly help in the treatment and the interventions. So what would you say to that? Do you think that has a large part in this, that their caregivers and being in their own setting has helped tremendously?
Yeah, I think it has part for many of the reasons you pointed out. I think everyone is more comfortable. And I think when you're more comfortable, I think you're more likely to learn, right? Whether that's for the parents as well as for the child. The other thing that's been important about so just a couple of things I do want to say though about what the parent implemented interventions we've done is, we don't see this as like a replacement for the speech language therapist. What they do is really important, but they only have, maybe an hour a week with the child. And one of the things that we thought about the parent implemented approaches is, in theory, the parents are with the child like every day, most of the day. And so they can provide therapy, all the time. We wouldn't suggest that, but they certainly can provide kind of a bigger dose of the intervention than a clinician could. And so we see it as a really nice extension of what the speech language clinicians are doing. And I think a lot of people would see the kind of the same thing as happening in other areas. For example, one of the areas that we have a really great clinical program in at the Mind Institute, we have 3 psychologists who are trained not only in autism, but also in cognitive behavioral therapy for anxiety. And they've kind of wed those interests, and they provide cognitive behavioral therapy to children and teens and young adults that have autism. and it's been a very popular program. And it's been so popular that the waiting lists are just really kind of pretty dramatic. And so that to try and change that, they also have tried to train other providers in our region so that families have more options. But interestingly, during the pandemic, they very quickly, these psychologists, switched to providing the cognitive behavioral therapy through telehealth. And they've said that in some instances, they think it's worked better. In other instances, maybe not, but it really lent itself to that. So again, I think a lot of what we do, if we think about it and be creative, and our goal is to get help to families, then technology can help do that. On the other hand, I think we've also seen in the news and talking to people who are teachers or families that have kids with disabilities, we have not been so successful in the United States with a lot of our remote teaching that we've done for kids with special education, partly because we weren't prepared to figure out how to support these families so that they could get their children engaged in doing kind of internet-based learning. So, again, I think it's not just about turning on the internet and plopping a kid in front of the computer screen. I think we really have to think about how we do this and be thoughtful about it, and then recognize that maybe not everything is going to work by telehealth or technology, but certainly it requires research and evidence to make sure we understand what works and why it works and the conditions under which it works, and then things that won't work through telehealth.
Right. I mean, you bring up a very important point, because even those that are in typical traditional style classroom settings through Zoom that are not in special needs programs, some parents have talked about how challenging it is for elementary age students, I'm sure even all the way up to high school, again, in the traditional type of setting, to sit still. And so I imagine with children with special needs or students with special needs, they take on that same challenge. That's a very important point that you bring up. And it's interesting to see how that is kind of unfolding in our current state right now. And it'll be interesting to see also if there's going to be additional services or resources to kind of address those barriers in the classroom setting and teaching. I want to be respectful of your time, so I'm just going to ask you one last question, and that's if somebody is interested in your type of profession, what would you recommend to them in terms of schooling and also just in terms of any recommendations or words of encouragement?
Well, I mean, I think it's an incredibly rewarding field to be in anything in behavioral health sciences, whether it's a research career or as a clinician. And I think there are lots of different roles. And I think one of the things that I've learned about in my time, as I mentioned when I started, I was interested in language and communication in people that have disabilities. And as we've focused on that, what we've learned is you can't really understand language and communication challenges in someone if you don't understand the family dynamics, if you don't understand if they have anxiety, if they have, strong auditory memory, are they depressed? Do they have attention problems? And so you really need to kind of, when we think about whether it's from research or providing care, you need to kind of have like an interdisciplinary approach, people that have expertise on all of these things about the individual and about the family and about systems of care and things like that. And so I think that it's a very exciting field to get into, no matter what your particular perspective. For me, it was always research that drove my interest. And it's been incredibly rewarding because I feel what I do makes a difference. And I think people that go into our fields, right, we want to have an impact on families and on social systems so that things continue to improve for people that have behavioral health challenges, whatever they are. And so I think I would say, just start out, figure out what you're interested in. There are multiple fields that can provide access to really great careers that will allow you to have an impact. And then you need to make a decision about, where your passions lie. Do they lie in being a clinical provider? Do they lie in being an administrator in a health system or in a special education school system or in research? And I think all of those things are incredibly valuable. And for many people, they're able to do multiple things in that way. And the other thing I would say is that we don't we have not done a very good job in this country in general of providing support for people that need help, whether it's because they have intellectual and developmental disabilities or they have mental health challenges. And so I think there's a lot of room for us to do better as a society, but that's not going to happen if people don't go into our fields. And I think it's a very, as you know, it's really hard. You know, we probably don't make as big a salaries as other fields, but I think it's really a privilege to do what we do, and it's incredibly rewarding. And if you're going to work hard, it's good to work hard at something that has value and that you enjoy. So I can't imagine a better career. I've been really blessed, and as I said, it's been a privilege to do what I do.
Well, thank you so much, Dr. Abbeduto. We can really hear the passion in your voice as you talk about your career, and much more than that. It sounds like more than a career to you. It sounds like something that you were meant to do, and the families that you work with and the staff that you work with are very lucky to have you as a provider and as an administrator. So thank you so much for taking the time to talk on the channel today. And if you're interested in learning more about Dr. Leonard Abbeduto, again, his most recent book, December 2020, it came out, and it's the American Psychological Association Handbook of Intellectual Developmental Disabilities. So that is for sale online if you want to Google that. And then he also has 2 other books that are well known: Language and Communication and Mental Retardation Development Processes and Intervention. So that was in 1993. And then also Taking Sides, Clashing Views in Educational Psychology. So again, Dr. Abbeduto has done so much work and a plethora of knowledge. So if you're interested in reading some of his work, take a look at that. Thank you again. Talk to you soon.
Thank you very much. I enjoyed it.